Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. It's 9 o'clock on Friday, and you're joining me here on Facebook or YouTube, so you know what this is. Welcome to Friday Friends. As some of you might be new to watch, and for those who are joining me again, welcome back. For those new viewers, I am Deb Burton, the Executive Director of RI Elder Info and rielderinfo.com. We provide the most comprehensive resources for seniors, caregivers, and professionals here in Rhode Island. We do a lot of community outreach and community education to help people get connected with the information and resources they need to stay independent. Whether you're an older adult here in the state or a caregiver or a professional who works with older adults or caregivers, RI Elder Info is the place that you want to check out on a regular basis. We have weekly newsletters that go out, one for seniors and caregivers, one for professionals, and one for individuals who do a little bit of both. So I encourage you to sign up for our newsletters. Every week here, I come on and bring another guest with me that is providing information and resources that you need to know about. And if it's not you personally that needs the information we're discussing today, then I can promise you it is somebody you know needs the information we talk about. So it's really important that you hit the like button and the share button to get this information out. Share it out in your community groups and any kind of friends and family groups that you might be a part of, because we need to get this information out to people as broadly as we possibly can. So for those of you who don't know, RI Elder Info is a 501c3 nonprofit. We are sponsored by a variety of wonderful organizations. One of them just renewed their sponsorship for yet another year, Oak Street Health. They provide primary care, really comprehensive primary care to individuals who receive Medicare. They have locations in Warwick by the Christmas tree shop, in Providence by the old St. Joe's, also on the other side of Providence by the McDonald's on Branch Avenue, and then another place up in Woonsocket on Diamond Hill, not far from the Planet Fitness. So I encourage you to check out Oak Street Health. They even have community rooms, and you don't have to be a patient there to go and enjoy the community rooms. They've got tech support. They've got computers you can access. A lot of cool stuff going on at Oak Street Health. Have to shout out to United Healthcare. My friend Jen Barrows over there is an amazing person who can help you get connected with the right healthcare plan for you. United Healthcare has some really great benefits for our Medicare individuals. So I encourage you to reach out to Jen. I also have great support from Tamarisk Assisted Living. It's a great small assisted living facility right over by the mall, easy on, easy off the highway. They really treat your loved one like family. So I encourage you to give Sue or Sean a call over there and set up a time to go check it out if you or someone you love needs assisted living or memory care. It's a great little place. Of course, what I do, because I am not handling the controls, backstage 321 Media, Ben Barber, he is doing the magic behind the scenes to make sure that everything comes through smoothly, because as much as I do stuff online, I'm not necessarily the 100% tech savviest person out there, and Ben makes me look good. If you've ever visited rielderinfo.com, you have visited rielderinfo.com, right? Well, you should, as soon as we're off the air. That is designed by the award-winning England studio web design team. So big shout out to Dave and Sal over there. They work magic. And RI Elder Info has won awards for its ease of navigation and ease of use because of their design work. So if you're looking for a website, check out England Studio. So I would like to introduce my guest today. He works for an organization that maybe not intuitively tells you that they do work with our older adults. But I got to tell you, the work they are doing is really awesome, and you need to know about it. I would like to invite up Mark from the Rhode Island Parent Information Network. Hi, Mark. How are you?
Hello, good morning. Very good. Very good to be here. Thank you.
Thank you for coming on. So, RIPIN, as it's often known by its acronym, it doesn't intuitively tell me the Rhode Island Parent Information Network that you do work with older adults, but you guys do a lot of work with older adults. Can you share some of the things that you're doing?
Yeah, we do. And so we were founded, 30 years ago. Actually, this year is our 30th anniversary, and we were founded by a group of parents who were advocating for their children who had disabilities in the public school system. Like a lot of organizations, we've grown and we've expanded into other areas, and so yeah, now we do quite a few different programs and services targeted at the older adult population. I think the one that is probably the least well known, but at the same time is the most helpful, is our healthcare consumer assistance call center. So we operate a call center that is staffed by experts who can help individuals with their health insurance. If they don't have health coverage, can help you get it. But even when you do have health insurance, sometimes it can be really confusing as to how to use it with things like provider networks changing and different coverage levels. It's not always clear sort of what's covered and under what circumstances. So this call center is able to do everything from answer simple questions about your health coverage, all the way up to helping you file appeals with your insurance provider if, for example, something isn't covered, if coverage is denied for a service that is medically necessary. Sometimes the insurer doesn't feel the same way, and there can be disputes there. And we help Rhode Islanders sort of troubleshoot that and navigate those issues all the time. It's a free to any Rhode Islander, no matter what type of health coverage you have, private, public, if it's from your employer, if it's Medicare, if it's Medicaid, if it's Medicare and Medicaid. We're actually the designated on buds person program for individuals who have both Medicare and Medicaid, which, as you can imagine, uh, having one of those coverages can be difficult to navigate for anybody. When you combine them, it can really increase the complexity. But we have experts on our team who troubleshoot Medicare and Medicaid issues all the time, and they've been able to help a lot of Rhode Islanders.
So, when you say you help them navigate, so first of all, I don't know that everybody knows what an ombudsperson might be, but say for instance, I need a special treatment, or and I need to go to Boston, but that my health plan is saying that's not within the allowed category, but that's the only place that I can get the treatment I need. Can you help maybe get that covered, get that, something, maybe reduce my costs of copays or things like that? Can your ombudsperson help me with that?
We certainly can. Our healthcare consumer call center works on issues like that all the time. Now, it's not guaranteed that we'll be able to, get that particular specialist visit in Boston covered. Um, but there are different things both in the insurance coverage documents and in state and federal consumer laws that our call center is able to look at your coverage situation and find out if is a situation where there should be an exception to allow you to see that out of state provider, or, for as another example, see that particular specialist that maybe your primary care has referred you to, but your insurer is saying, oh no, that's not covered. And it doesn't always work out. I don't want to kind of overpromise, because sometimes your coverage just doesn't include whatever the thing in question might be. But a lot of times people are denied services, they're denied coverage when they shouldn't have been. Sometimes, and this happens a lot with Medicaid in particular, people lose their coverage when they shouldn't have, due to lots of different circumstances. It could be anything, different mistakes that might have been made. But we've been able to help restore that coverage for folks. We've been able to get those specialist visits covered, and it really is going to depend on the individual situation. But I will say that I believe since 2018, our healthcare consumer assistance call center has saved or returned something like $3.9 million to Rhode Islanders in things that either they should have had to pay and then were refunded. Things like you hear about surprise billing all the time, where you get billed for something that you were never supposed to be billed for, or getting things covered that were originally denied, getting those appeals processes, seeing those through. So yeah, so not quite $4 million in the last
Wow.
4 years or so.
That is absolutely amazing. So when you're kind of, your regular Joe or Jane out there, and you're looking at all these different insurance paperworks and they're saying no, when they call your team at Ripin, is your team able to kind of speak in layman's terms and not kind of, insurancy terms? Like real people will understand, they can make it, like, break it down so it's understandable?
Absolutely, yeah. That's the goal, because the insurance is confusing because it's a lot of jargon. It can be very overwhelming. I have worked in healthcare policy. I have a hard time understanding my health insurance coverage and kind of where it's at and what it covers and what it doesn't. And there is a lot of confusing terminology. Our team is there to cut through all that. So you can call up with your, you know, plain English or any language. Actually, we're able to serve people in a lot of different languages. But your plain question, your layman's term question, and we're able to answer it in language that you're going to be able to understand as a consumer. And another thing that we sometimes will do in working with our clients is we will get on the phone with our consumer that we're assisting and with the insurance company at the same time, or sometimes with the consumer and their medical provider at the same time, and sort of be on that call, so that when that individual from the insurance company is saying something that might be over the consumer's head, we're able to come in and say, could you please explain that? Could you please break it down? Or we'll break it down for the client that we're trying to help. So it's all about cutting through that jargon, making it more accessible for the everyday consumer, and helping people get the coverage and get the care that they should be able to access.
Absolutely. And I think that that's one of the things that is really unique about the service that you're providing for the healthcare ombudsman, is that you can hop on the call. So it's not, I'm calling my health insurance company. They're telling me something I don't understand. I'm hanging up. I got to call Ripon. This is what I think they said. It becomes almost like a game of telephone, which just gets, like, really, really aggravating. So it's good that, people have the ability to call your office, and your office, that's the 401-270-0101, right?
Right, that's correct.
Awesome. Yeah. So people can call there to get the help that they need figuring out their insurance. And, like, I totally get, sometimes the answer is just no, it's not covered, or yeah, you really do owe the bill. So it's not that you can work magic, but I would say at least 3.9 million times you've worked magic. That is awesome. So what are some of the other programs that Ripon is offering for the community for the older adults?
Sure. So other than the healthcare consumer assistance service that we offer, again, to any Rhode Islander, no matter what insurance, we also provide a number of different wellness programs that are open to usually any adult, but they are often, the topics are targeted at things that older adults might be particularly interested in. So this is part of something called the Community Health Network, of which Ripon is a member, and we help coordinate these wellness programs. They're all evidence-based programs. They're things that have been shown to improve people's health and improve their outcomes. They are all taught by certified trainers. They're all presented by folks who have some expertise in what they're presenting, and they touch on topics from chronic disease management, diabetes prevention, diabetes self-management programs. There are different programs that help with balance and with fall prevention. So again, particularly of interest to some older adults, that can be a special challenge, because if you suffer a fall, you can be very reluctant to get up and get moving about again. which is only going to lead to worse health outcomes. But these programs have been demonstrated to help people, get back up, get that confidence back, and be able to move about. Most of these programs right now are virtual because of the pandemic, although we are slowly starting to see some of them come up and happen in person. But even the virtual programs, this is a program that took a little bit of time to transition to a virtual setting, because they knew from the very beginning we can't just do what we do and do it on a computer and call it an evidence-based program. We have to make sure that it still works. And so they put in the effort and they put in the time to adapt it to this medium, and so folks can get the same benefits of these evidence-based wellness programs on their computer and in their home. And it's really opened it up to a lot of folks who I think maybe otherwise wouldn't have been able to access it.
I think that's true. Like in the last, well, now, geez, it's almost 2 years. Adaptation and pivoting are really key to being able to connect with folks. I think I saw in your availability of classes the Powerful Tools for Caregivers program as well. And that's for those viewers who aren't familiar with the Powerful Tools for Caregivers. That one is really important that you participate in when you are caring for an individual who may have dementia or other chronic debilitating diseases. It's an amazing program. So I encourage you, check out the RIPIN website. That's RIPIN.org, and find that class and sign up, because it's really helpful to make sure that you're taking care of yourself too. And that can be a hard thing to remember to do when you're a caregiver. So Mark, one of the things that I've seen and heard in meetings recently is you have a program where individuals from RIPIN are working with our local hospitals to help people be able to return home instead of going into a nursing home or other type of rehab facility, to really help them, be able to manage at home. Can you tell the viewers more about that program?
Yeah, sure. So we do have staff embedded in many, probably most at this point, hospitals across the state of Rhode Island. And the whole idea there is just what you said. For those who qualify for this program, and there are some eligibility requirements. These are mostly folks who are Medicare, Medicaid, dual enrollees, I believe. But the idea is, to keep them out of that long-term care setting as much as possible. So a lot of times after a hospital stay, an individual will not really have the right care options set up at home to be able to return home or return to their community. And a lot of times people get sent to nursing homes or long-term care facilities. This is, for society, very expensive, and obviously not always the best answer for the patient. So we are participating in a program, the Hospital Care Transitions Initiative, it's called, and that is trying to guide some of those. So our staff who are embedded at the hospitals are connected with these individuals as they're discharged, to work with helping them set up community-based supports and supports at home, connecting them to our care management team so that they can return to their home and ideally, sort of stay there and thrive with the community supports that are available, rather than having to go to a long-term care facility or an institution.
Yep. And just to be clear, RIPIN is not the organization that's going to provide a CNA that comes out to the house or the nurse that comes out to the house, right?
What we're going to do is we're going to connect the patient to those services, and we're going to kind of do the care coordination and some of the care management around that. Now, we are going to provide our own support, and our team on this Hospital Care Transitions Initiative, they are there to, not just make referrals and coordinate care, but they're their own kind of support system and supportive network for the patients. I hear in my role as a communications director, I often have the pleasure of talking to clients or patients or consumers whom we've worked with, and they always have wonderful things to say about the team in our care management programs. They're really they're really building relationships with the people that they're serving, and I think that's what sets RIPIN apart from a lot of other organizations.
That's one of the reasons I really like RIPIN, is that you do connect. I know, um, well, actually, let me have you share for the individuals ordinarily, when RIPIN started, there was a unique qualifier for almost all of your employees that they had to have lived experience. Can you tell folks more about, RIPIN's philosophy about really having people who know what you're going through help?
Yeah, I'm glad you asked that. I'm glad you brought that up. So this is the thing that really makes this special. So RIPIN is built on a peer support model. And I mentioned we were founded 30 years ago by a group of parents whose children had disabilities, and they needed, special help in school. This is 1991. We didn't have the disability advocacy that we do today, although it was really starting to get going at this time. It was a very special time. These parents were just, that's all they were. They were parents who came together to help and support each other and form what became known as the Rhode Island Parent Information Network. And you fast forward to today, and we don't just help parents of students with special needs. We help all Rhode Islanders of all ages, sort of throughout the life cycle. But that peer model is still at the core of everything we're doing. So over 3/4 of our staff and the majority of our board of directors are peers, meaning that they themselves have a loved one. It could be a child, it could be a parent, it could be another relative or friend, someone that they have cared for themselves who has special needs, a disability, or a chronic condition. They have the firsthand experience of navigating these complex systems on the behalf of a loved one that they're caring for, in their personal life. And then they come to work at RIPIN. We combine that lived experience with really high quality professional training and development, certification programs. A lot of our staff are certified community health workers. We're actually, I believe, one of, if not the largest employer of community health workers in the state, proportional to our size. So it's all about taking that lived experience and leveraging it, and that allows us to help people in a way that we otherwise wouldn't be able to, because we're coming into every situation with that personal understanding of what it is you're going through. We've lived it. And it just, I think, brings for our staff a level of empathy that they otherwise wouldn't be able to bring to the work.
Yeah, I think that's one of the things that it means that that person on the other end of the phone really understands and gets it when they're having that conversation. Um, Tell me, what other languages can people receive help from in RIPIN? What other languages does your team speak?
We have folks on staff who speak Spanish and Portuguese, Cape Verdean Creole, and there are some other languages that folks on staff speak as well. But we work with translators, interpreters. We have a language line that actually is able to service hundreds of different languages. So folks should call RIPIN, and we can connect with an interpreter and really help anyone, no matter what their language is.
That is so important because, for RA Elder Info, it's important that we work to reach all Rhode Islanders, not just the ones who maybe speak English, but to reach really everybody, because knowledge is power. And when you can access information and resources, you know, on your own, that is awesome. And part of that is, overcoming the language barrier and having it not just be a straight translation, but an actual interpretation. Not every time does word for word translate in other languages. So it's really important to actually interpret. So that's one of the cool things RIPIN does. We were talking before the show just a little bit too about how RIPIN is helping people get connected with telehealth. We're seeing, unfortunately, a little spike in the COVID cases, and people might be a little more hesitant to go to their doctor. And obviously, we want to make sure that people get the care that they need. If you're having some real medical emergencies, please don't hesitate to call 911. But if it's a scratch or something like that, and it could be handled maybe via telehealth, how can RIPIN help people connect with their physicians for telehealth?
Yeah. So we are doing this sort of pilot program. Is brand new. So as you mentioned, with the pandemic and for lots of reasons, older adults in particular, it can be hard to get to the doctor.
Mhm.
And of course, that's not good for their long-term health outcomes. Telehealth, telemedicine, we hear a lot about during the pandemic as more and more providers began to offer it to keep themselves and their staff safe and to keep their patients safe. But for some people, accessing a virtual medical appointment is challenging, either because they don't have the technology or they aren't able to utilize the technology. They're not as tech savvy as maybe some other folks are. And so to make this telemedicine appointment, log on to it, participate in it, there are some barriers. So this pilot program from RIPIN is basically a facilitated telemedicine program where we're going to help you as the patient do all that. If you have a provider who offers telehealth services, you can connect with our community health workers. And what they're going to do is they're going to help you make the appointment. They're going to help you interface with whatever portal your provider uses, make the appointment, and then they're going to show up with all the technology you need to attend the virtual visit. So if you don't have a laptop at home, we'll bring one. It'll have a camera. We'll bring headphones and microphone. You'll have all the technology pieces you need. We'll help you log into the appointment. And then we will also sort of, while giving you the space to have your medical privacy while you do your visit, we will like stay on hand in case something goes wrong, you get disconnected and you need that tech support. So these are, I want to say again, certified community health workers. So they're
Yep.
folks that know what they're doing in terms of both the technology, but also in terms of working with folks in the community. So anyone can call RIPIN if they're interested in this, and we'll work with you to figure out which of your providers offer telehealth, telemedicine, and work with you to figure out a time that we can come and support you. So that's really, we're really excited about that because as you mentioned, it's hard to get out there sometimes, but missing those appointments can lead to other longer term health problems. We heard a lot, I think a lot of us heard about how the cancer rates went up because during the pandemic, people were afraid to go get those screenings. And now, of course, we're finding folks that are finding cancers later than they maybe should have. So we're hoping that this telehealth, telemedicine program empowers people, connects people in a way, and keeps them from missing those important medical visits.
Absolutely. And one of the things that, I think pops in my mind that might be a question viewers have is when you're bringing in like headphones or a laptop or something like that. Once, before it comes into your house and after it leaves your house, it's all sanitized, so it's safe. It's not something like everybody else is like stuck in their ear kind of thing.
Yeah, it's all, yeah, no, we're not gonna share earbuds between folks for one thing. We're definitely gonna have all the equipment cleaned between each visit. And also gonna follow all safety protocols when we're coming to you and visiting you in your home in terms of wearing masks. I'm sure most of our staff are vaccinated, if not all of our staff at this point are fully vaccinated. So it's going to be safe, secure, and private for you as the patient. None of your information is going to be stored on any piece of technology. It's all going to get wiped. So we take the privacy and security and safety piece of it very, very seriously.
That's really, really good. And the person who's coming in is not going to be like, "Ooh, what's wrong?" They're
Nope.
going to give you
Yeah,
a space, or maybe, go sit outside the front door so you can like wave if you have an issue. Um,
exactly.
yeah, that's really good. Now, when people call and ask for help, is that all considered confidential?
Yeah, all of our calls to Ripen are considered confidential. All of our services are free, available in multiple languages, and 100% confidential.
That is awesome. What other cool things is Ripen doing these days?
Oh boy. Other than what I talked about, I think we are really excited about the telemedicine program. Not to hit it too hard again, but it's one of those small things that really has a chance to make, I think, a big difference for folks. And I think I could see it becoming something that goes on. Right now it's just a pilot program, so we are really excited about that. We are getting ready for the new year, like a lot of folks, and planning and booking even more of those wellness programs that I was talking about. Not just more sessions of things like you mentioned, powerful tools for caregivers, which is a great program that we offer a couple of times a year, but also adding new programs for folks like Strong African American Families is a new community health network offering that we've put up recently. We're working with the Alzheimer's Association of Rhode Island on a series of information sessions, virtual information sessions. The early warning signs of Alzheimer's. We know that early detection is super important in terms of determining, the quality of care. So this information session, we have a couple of them coming up, and we do them throughout the year. It's going to show you the 10 early warning signs, the things to kind of be on the lookout for a loved one, that they might be developing or might have Alzheimer's or dementia. So that's another really good program that we have sort of on a regular basis at RIPIN.
That is awesome. And Carrie Lynn Edge said, I honestly would not have known about this service if it weren't for your show. Thank you. So I'm
Thank
really
you.
glad you were coming on today. So is RIPIN a nonprofit?
Yes, RIPIN is a independent 501c3 nonprofit organization. We are funded by different grants and donations. We're not a government entity. We're totally independent.
That is awesome. If people who are watching, if they wanted to support RIPIN, how could they do that? Do you need volunteers? Do you need more staff? I think at this point, everybody in the world needs more staff. Maybe not RIPIN, I don't know. But funding, what would be helpful to support RIPIN with all of these amazing programs that you're doing out there? Because this is great stuff.
All of that is helpful. And I think that the easiest way to help is if you go to our website, ripin.org, and you're going to see a big banner across the top, and it's going to say one of those buttons is going to say how to help. And that will connect you to how you can make a financial contribution, donation to RIPIN, sign up as a volunteer, or help us in other ways. And we really do appreciate any support that anyone can offer.
All right, that's awesome. And the website again is ripin.org, and the phone is 270-0101. That is awesome. So there's the website right up there, and people can go ahead and click on that and be taken right to your website. Mark, I am really grateful that you have come on today. I don't know if you've been checking out the comments. We have reached a new echelon that it seems like we might have some trolls that are popping in. We're pulling those down as fast as we can, but that's, I don't know, that's kind of interesting that we have reached that level that they're pretty active.
That tells you, that's something. That says
Yeah.
something about our reach today.
Yes, absolutely. Absolutely. Well, I'm so glad you came on today, and I look forward to maybe doing some collaborations between our organizations. I think what you're doing is absolutely amazing.
Well, thank you so much for having me. It was my pleasure to be here. We really appreciate this.
Thank you. Well, everybody, truly, RIPIN is an amazing organization. And even though Rhode Island Parent Information Network, you can think of it as if you're a parent yourself and you're caring for an individual who has some different abilities, or maybe if you're caring for a parent or you're older, they have some truly amazing programs. Their staff, I got to tell you, they're really nice to talk to. They speak multiple languages, so I really encourage you to give them a call at the 401-270-0101 number. You can also check them out at ripin.org. Truly a hidden gem that I would really like to hope that many of you reach out to, because there's really a wealth of opportunities there. So I really look forward to getting you guys connected with RIPIN. So in the meantime, I look forward to seeing you all again next week. I hope that you've hit the like button and the share button, and I look forward to seeing you And in the meantime, I hope that you have a wonderful, healthy week. Be well and be kind. Thank you.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.